So you're ready to go?
Thanks so much. Yeah, that sounds great. Check this. My last items up here. Okay. Well, I am excited to talk to you all today. So I am I'm an attorney. I'm also a trained social worker. And I work for the Disability Law Center. So I am going to speak with you today about survivors with disabilities, and this is sort of a broad, a far-reaching presentation that we're gonna that we're sort of gonna work through today. So I'm happy to take questions. Normally, when I do this presentation, I like a little bit of interaction. If that's something that folks are interested in engaging with, great. If not, that's okay too. We'll just kind of gauge it as it comes and go from there. So we're just going to start out with a quote. This population is extremely diverse, not only by gender and severity of disability, but also by age of onset and how people live with their disabilities. In addition to the wide range of disabilities and multiple disabilities, the population crosses all the cultural, class, sexuality, race, and ethnicity lines as well. We are literally everywhere. This is a quote by Tana Stowe. She was a disability rights activist from Canada. I think that this quote really encapsulates the sort of that idea of identifying across all lines and how disability can be a part of an identity, regardless of who you are, how old you are, where you live, you know, your race, your gender, all of the things. This is a part of the human experience across the lifespan. And Andy, I'm getting notices of folks waiting in the waiting room. I think I'll let you go ahead and I'm assuming you're monitoring those. Okay, good. Yeah, looks
Yeah,
like
it's joining.
Okay.
Yeah.
Perfect.
Awesome.
Okay. So we only have, just this time together this morning, but there's so many things that we can talk about related to disability. If you want to continue the conversation at any time or you're interested in another training, let me know. Today's learning objectives are the following. So we're gonna we want to understand basic terms and concepts concerning people with disabilities. We want to review statistics and intersectionality with disability, discuss effective advocacy tips for this population, understand accessibility, accommodations, and modifications, and reduce fear in working with people with disabilities. I'll sort of start here just a bit. So surveys have shown that most people are uncomfortable interacting with people with disabilities. It's just, I think, a discomfort maybe in knowing like how to behave or being uncomfortable or sort of, we all have implicit bias and sort of what does that mean and what does that do? And how do we kind of work through those things? In this group, and if you could just maybe put in the chat, what are people's experiences of working with folks with disabilities?
I know specifically for me, who has worked for coalitions, most of my adult life is specifically working with deaf and hard of hearing folks. And then one of the big issues that's popped up is wheelchair access to shelters and the lack of. Yep. Some folks are saying deaf and hard of hearing community. Yep. Someone said both of their daughters have ADHD and their oldest has autism and was working with CASA volunteers before COVID. Someone said knowing or if I'm aware of their disability, it's been the exception, not the norm. more of the invisible disabilities that have been more pressing to address its needs. Respite care aid for teens and youth, a group home. Yeah, so it seems like there's a kind of a bit of a spectrum of what folks are experiencing.
That's really great. Yeah. These are really, really great comments, and yeah, kind of a wide range of areas working with folks with disabilities. I think that this comment from Jamie is really great, sort of knowingly if I'm aware of their disability. I think that that's true more and more in visible disabilities. I think that that's exactly right. That oftentimes we're working with folks that do have an invisible disability, and we might not know that that disability is present. And so I think that that's what makes it really important about sort of how we conceptualize sort of disability across the lifespan, and that anyone might either presently have a disability or have a disability in the future. And so how we incorporate that into our work. Okay, so we're gonna move forward. If I can advance my slide, we'll see. There we go. Okay. So next we're going to talk a little bit about what is disability. So there's sort of three models, primary models of viewing disability: the moral model, the medical model, and the social model. I don't just want to present from the medical model. There are other ways that people conceptualize disabilities. We're going to talk about these three broad category models. You'll encounter all of these models and people who talk about disability from all of these models. So the moral model is sort of the oldest kind of model. This is sort of that idea of there's some supernatural piece to explain something that people don't understand. Spirits, karma, cause and effect. Sort of maybe that idea you've heard before, sort of like, what did we do to deserve this? That kind of thing. The sort of core parts of this model is that people are morally responsible for their disability, and that disability may be seen as a result of previous actions. Those are usually previous bad actions, because it's sort of viewed in a negative light. And then many of these ideas persist today. I'm sure that as I'm talking, you're sort of picturing some examples that you've encountered in your life. The next model is a medical model. So this is sort of 1800s on. So doing the presentation, I'm going to sort of go back and forth primarily between the medical model and the social model. The DSM, for example, is the medical model, right? Sort of the conceptualization there is there's something wrong with an individual. You go to the doctor in order to get it fixed. So ultimately, in this model, the view is that disability is caused by the health condition a person has, and the nature of this condition will determine what they can and can't do. The medical model would say that in order for everyone to participate fully in society, everyone would need a non-disabled body and mind. This model sort of makes disability the result of the person being different, and not the result of how society views them. This model includes a lot of definitions, diagnoses, causes, those kinds of things. Closely tied to the medical model is something called the tragedy or charity submodel. You probably also encountered this. This is sort of, oh, you poor thing, how sad for you, or sort of that idea of when we see like inspiring stories. Sometimes that's something that's sort of a term for that is kind of inspiration porn, which is sort of like we feel good when we can sort of see people that we sort of societally view as being, that we sort of feel need tragedy or need charity. We sort of see them as succeeding in some way. So and then the third one I'm going to turn to is the social model. So this is the model here is what makes someone disabled is not their medical condition, but the attitudes and structures of society. The social model of disability was developed by people with disabilities themselves in the 70s and 80s. It came as a reaction to the medical model of disability, which had sort of widely been agreed upon at the time. And so this was sort of an ownership and a reframing of you know, how is disability viewed and experienced. So next we're going to go through some concepts and some terms to understand. So this definition that we're going to look at right now is the basic definition in many laws, including the ADA, so the Americans with Disabilities Act, and the FHA, the Fair Housing Act. These definitions are good to understand because they may determine the rights someone has or the services someone may or may not be eligible for. So this definition says that disability is a physical or mental impairment that substantially limits one or more major life activity. This includes people who have a record of such an impairment, or even if they don't currently have a disability, or individuals who don't have a disability but might be regarded as having a disability. The ADA also makes it unlawful to discriminate against a person based on that person's association with a person with a disability. Some examples of major life activities are things like, all kinds of things, right? Sleeping, eating, walking, talking, concentrating, thinking. Those are just a few examples. I feel like sometimes my slides aren't quite advancing. Okay, so we're gonna talk a little bit more about some additional terms. There we go. So first we're gonna talk about ableism. So ableism is another ism, you know, like sexism or racism, but we're talking about disability. This is an idea that's also sort of grounded in the medical model, based on the medical model. So ultimately, what ableism means is that able bodies and minds are viewed as the norm, and disabled bodies and minds are outside of the norm. A disability is viewed as something that must be overcome or something that must be fixed. And systems of power as well as resources are set up to meet the needs of non-disabled individuals first. So in this photograph, you sort of see someone, you know, at the base of a set of stairs in what looks like probably maybe like an apartment building, right? So when planning a city or a building, the plan is usually focused on able-bodied people, right? And then disability access is sort of tacked on as an afterthought. So the idea of ableism is sort of people who don't have disabilities are the people who are served first, and those with disabilities are the afterthought. As I mentioned earlier, sort of that idea of inspiration porn, sort of that idea of being really inspired by people who are sort of overcoming things is also sort of from this perspective, right? This ableism perspective, like we are the norm, this person is different, and yet they look at all they have accomplished, that kind of idea. So next we're going to talk about paternalism. So this is very much sort of related to ableism. Paternalism is a policy or practice in which people in positions of authority make decisions in the supposed best interest of subordinates. And if you think about this word, right, paternal, like parent, right, that's sort of the core of this. So folks making in positions of authority, making decisions. The legislature is a really good example, right? When we think about the legislature in Utah, how many representatives, how many folks up there do we know that sort of are vocal about having a disability? Not many, at least those who are open about it, right? And yet that body of people are making decisions for people with disabilities. So that's just one example of how we could kind of think about what paternalism is. So next, we're going to talk about the independent living philosophy. So this is a social model concept. It's definitely from the social model perspective. This views people with disabilities as the best experts on their own needs. So this is sort of about, right, lived experience, that kind of expertise. It views disability as an inevitable part of life. That sort of idea that we talked about sort of across the lifespan, people eventually probably encountering disability at some time in their lives. It views people with disabilities as a growing population with strength and independence, and also views the population as having few differences from the rest of the population, right? certainly disability is something that people experience. And for some people, their disability is certainly a very large part of their identity. And we'll get to that a little bit later in the presentation. But at the same time, we're all humans. We all live in Utah. We're all sort of experiencing the same things in our lives. We're all experiencing, different conditions that affect, that affect our lives, if that's social, if that's economic, whatever that looks like. And the difference might be that someone, also has a disability. This is also what's called the self-advocacy movement. And I would suggest that the independent living philosophy is the opposite of paternalism. So next we're going to talk about invisible disabilities. So first, not all disabilities are obvious, as one of our attendees mentioned earlier in the presentation. And then we're also going to talk about a little bit about neurodiversity. So neurodiversity is a word you probably heard, right? So the idea is that there's a natural variation in the human brain regarding sociability, learning, attention, processing stimuli, mood, and other mental functions in a non-pathological sense. So oftentimes folks who might be described as neurodiverse or might describe themselves as neurodiverse versus neurotypical would be the other word you would hear, are folks that might be on the autism spectrum, with ADHD or OCD, bipolar disorder, that kind of thing. This idea of neurodiversity is also from the social model, or a reaction against the medical model, right? It's about the way the person sort of experiences based on what society sort of has to say on that social experience. We can think about similarly, neurodiversity is sort of a spectrum, right? We can think about that in the same way we think about I think we're doing a better job as a society about thinking about gender or sexual orientation sort of as a spectrum. So next we're going to talk about disability from a cultural perspective. So a culture, is a group that has shared beliefs, customs, traditions, history, rituals, language, food, clothing, any of those kinds of things, right? Unspoken rules you need to be aware of. So when we're talking about disability from a cultural perspective, two of the things we often sort of think about are crip culture or deaf culture, right? So these are social movements that hold disability to be a difference in a human experience rather than a disability. So when we think about this is part of the social, social model perspective. Groups that share a culture, share history and identity, shared beliefs, that kind of thing, can be used as a lens when we talk about disability. So crip culture first is sort of from the reclaimed term cripple. This is usually about a physical disability or a physical component to the disability. This is about having experiences in common. This is a term that has been created by the population, so by folks with physical disabilities or physical component to their disability, sort of reclaiming that term and making it sort of a cultural identity. Deaf culture, a lot of you have probably heard about that. It's a term applied to the social movement that holds deafness to be a difference in human experience rather than a disability. So that might look like, American Sign Language as the language in that culture, how folks who are deaf experience music, what their beliefs look like, their activities, their history. If you want to learn more about either of these sort of cultural perspectives, there are two really good films that have come out in the last few years. The first one is Crip Camp, and that's a documentary. And the second is CODA, and CODA means Child of Deaf Adults. So we're going to talk a little bit about language next, and use of language. So this is sort of talking about common and everyday language, how people talk about disability, right? oftentimes folks might be referred to by their disability. For us at the Disability Law Center as an agency, our starting point is people first, but that's not necessarily where we end. So we'll sort of get there. So if we think about common everyday language, those are often labels. Maybe that looks like, someone like is autistic, an alcoholic, schizophrenic, that kind of thing. Then there's people first language. So this favors replacing disabled people with disabilities, right? Putting the person first. It favors the use of having rather than being. So a child with autism, a person with alcoholism, a man with schizophrenia. Those are examples of people first language. And then there's identity first language. So this allows others to self-identify their terms. So I am autistic, I am an alcoholic, I am schizophrenic. Or maybe I prefer to say I am a person with schizophrenia. And so that depends, right, on person to person. I think it's really easy to use pronouns as an example of this. I think that we've all become really pretty comfortable with seeing folks identifying their pronouns. So right now you can see that I have my pronouns identified as she, her in my Zoom name, right? I think that in this sort of virtual world, we've become a lot more attuned to sort of how people might wish to be identified, and that I'm telling you through this label that I've put here my own personal preference, right? Listing my pronouns with my name. And this is the same idea here, but with disability, right? So so there might be a way we can approach that, right? We might, start with person first language, or we might start with, common language, but then ultimately we're asking a person how they prefer to be spoken to or about with regard to their disability. So that might be people first, that might be identity first. And that might not be the same for every person with the same, sort of with the same disability. One person, with autism may prefer to identify as autistic. Another person with autism may prefer to identify as a person with autism. So it's really good to just ask and know what people want for themselves. So the next thing we're going to talk about, and I'm going to go ahead and read this slide. So this is a Special Olympics campaign called the R Word. So I'm just going to go ahead and read it, and then we'll talk about it a little bit. So the campaign is called Spread the Word to End the Word. And it reads, "That's so absurd, childish, ignorant, uncool, pointless, careless, irrational, senseless, irresponsible, unnecessary, illogical, trivial, truthless, ill-considered, dull, and you choose retarded by a dictionary." The idea is the R word, not a word that I use. I just used it because I was reading it out loud, but not a word that is sort of commonly accepted. And we've really, I think, worked really hard to change the way that language is being used, even in the law, to move away from that word, in medicine to move away from that word. These are words that, shouldn't be used to describe a person. There are other ways to do that. There are so many other ways to explain like a behavior. There are also words to think about that are other outdated terms, right? That are ableist terms. Some examples are handicapped, special, idiot, imbecile, moron. Just looking here. Psycho, crazy, insane, hysterical, gimp, lame, spaz, dwarf or midget. Those are all terms that are outdated and that can be really hurtful to folks, either when you're using them in common parlance, right, to talk about like a feeling you have or like an idea about something sort of in a way that you're sort of like, wow, that experience was crazy, like perhaps there's another word you can use. What could it be? I use wild a lot. That's my sort of substitute word when I'm trying to express the sort of strangeness or surprising nature of something. other examples like handicapped, right? We still see a lot of things like handicapped parking, handicapped, those kinds of things. We're trying to move toward accessible parking or ADA parking, those kinds of words. For example, handicapped is sort of from an old, the origin is from sort of Elizabethan times, when an individual might have been put on the street with their cap in their hand. And that person, you know, was often a person with a disability, and that would be how they might be, you know, attempting to support themselves. If you're using any of these terms in your life, maybe think about other words to talk about these things. And also thinking about not using them flippantly, using them as a slur, those kinds of things. I'm seeing a couple of comments in the chat. Yeah, some school systems still use special education. I agree with you, right? It's just education. It's right. It's education. It's a way, it's a different way to access education, right? It's having supports and services available in order to access the general education curriculum and setting. And so I think that's a really good example. Okay. So next, we're going to talk just a little bit more about language. So I think that staying away from disempowering words is also really important. So thinking about not describing someone as a victim or someone who suffers, right? So you wouldn't say, oh, that person is a victim of HIV, or that is someone who suffers from depression, right? It's not our position and our place to judge if someone feels that they're a victim or if they suffer from a condition. Instead, say that's a person with HIV or someone who has or experiences depression. Not all people with disabilities are the same or identify as a person with a disability in the same way. So that's why it's so important to ask a person how they would like to refer to their disability. Some really good questions to use are, what language or terminology should I use? And have I missed anything in meeting your needs? Oftentimes those questions show really that sort of informed not knowing, show that you understand that perhaps there's information that you require, but you're not the expert to know what the answer to the information is. The individual is the expert of their own life and their own lived experience. And it also shows that you're listening and that you're hearing the person and that you're attentive to the person's experience. So I'm just going to talk a little bit about mandatory reporting. I know Andy and some of the other training modules, I know that mandatory reporting is something that's sort of discussed. So I'm just going to talk super briefly about that. So ultimately, I'm going to just talk about mandatory reporting and how that relates to disability specifically. So if someone, for example, is sexually assaulted, there are statutory times in which it must be reported. This is true for certain individuals with disabilities who experience sexual assault, and these are the specifics. If you have any questions, the Rape Recovery Center can walk you through all of this. So sort of the idea here is you must report a person of any age who has been abused or sexually assaulted and has a developmental and or an intellectual disability. So you would only report a person with a physical disability if they're under age 18 or over age 65. So sort of in those vulnerable categories. So, a minor or someone who's over the age of 65. But if an individual has a developmental and or an intellectual disability, then that there's a cognitive component, right, to their disability, then that is when that would also become a mandatory reporting requirement. The report can be conducted through Adult Protective Services, Child Protective Services, law enforcement. Bottom line, refer to agency protocols, utilize your supports in making any mandatory reporting decision. So next I'm going to move to some statistics and some general so kind of overview. So we know that based on data, there are increased rates for sexual assault, abuse, and intimate partner violence across the board for folks with disabilities. abuse is also more likely to go unreported for folks with disabilities. I'm just gonna highlight a few statistics for you here. So we're talking about here, physical violence, unwanted sex, sexual assault. We're talking about all of those kinds of things. Persons with disabilities had a rate 2 times higher for rape than the general population. As many as 40% of women with disabilities experience sexual assault or physical violence in their lifetimes. According to separate studies, as many as 97% of sexual assaults among people with disabilities went unreported. Survivors with disabilities are also more likely to experience a longer duration of sexual abuse and are more likely to experience sexual violence from someone they know. So those are just a few, I think, important statistics to keep in mind. So next we're going to talk about risk factors. So some risk factors for folks with disabilities can look like powerlessness or vulnerability. So if you are an individual with a disability that has a component in which you need support by a caregiver or medical professional, those kinds of things, or a family member, abuse can happen in those areas, right? There's more powerlessness to vulnerability because you're sort of at the mercy, if nothing better than that, or at, sort of open to the treatment of the people who are supposed to sort of protect you and take care of you. For example, if I need assistance to go to the bathroom or to bathe and shower, that puts me in a more vulnerable position, right? Because I'm trusting another person to help me to engage in those tasks, and that person could ultimately harm me in those situations. So those are needs for personal care. There's also a risk factor. Isolation is a risk factor. We're talking about both physical and social isolation, right? So physical isolation, if someone is sort of, lives in, maybe lives with a caregiver and doesn't really leave their home very often, doesn't engage with the community. And so that could be physical isolation, but also that social isolation, not having contact with others. Physical defenselessness as well. Language, speech, or vocabulary barriers, impaired or limited developmental or intellectual abilities, lack of abuse prevention education, lack of sexual autonomy. Both of those I think a lot about when I'm thinking about sex ed and what do folks, so I mean, our sex ed is what, is sort of inclusive to the degree we get it in school, right? About healthy relationships, about how to protect ourselves, about consent, about all of those things, about information about our bodies. And so of course we only get as much of that as our public schools sort of provide to us, our legislators sort of said is acceptable for us to have. But oftentimes folks with disabilities aren't getting any of that because they've historically been maybe separated, when we're talking about earlier special education, right? Separated from their same age peers and maybe in a special education class, something like that, and then have not been exposed to some of that education, particularly education about consent. And then also lacking sexual autonomy, right? So being not feeling able to make decisions about one's own body, and how one uses one's body or doesn't. So that's both in how someone else might touch or engage with our bodies, but also how we might want to engage with our bodies, right? Sort of that some of those social norms about or social ideas about sort of what a person with a disability might or might not want in their life. Sort of those stereotypes and misunderstandings, those sort of ableist ideas. And last, unsafe organizational structures and policies. So an example here would be when you think about your agency that you might work for or volunteer with, are people with disabilities being put in unsafe situations, right? based on the structure and policies that you have in place within your organization. One example here might be at the state hospital, historically people haven't been able to choose their roommate, and you could be put in a room with someone who could take advantage of you or assault you, and that sort of that framing of how do we think about structures and policies organizationally and what might put people at higher risk. So this is just one example of a power and control wheel. Sort of the idea that abuse isn't about sex, right? It's about power and control. There are similar wheels that exist for disability, and sort of what that looks like, what a power and control wheel looks like when we frame it around disability instead of violence. So I'm going to talk next a little bit about signs and symptoms of possible sexual assault in folks with disabilities. So sort of, bottom line, any change from baseline. The more signs and symptoms that are present, the more likely abuse is occurring. If someone's been assaulted, there are many reasons why someone might not say something, as you know. But we're talking about disability here, and these are the things specifically to know when we're talking about disability. We all have a baseline and how we go about our life, day to day. And so we have to think about what that baseline is for any individual. And for individuals with different disabilities, those baselines might look different because of the physical or emotional or cognitive nature of the disability, right? So thinking about what that looks like. So if we're thinking about some of those areas, we're thinking about medical, we're thinking about like STIs, unexplained stomach aches or ulcers, frequent urinary tract infections. We're talking physical difficulty walking or sitting, changes in eating habits or sleeping habits, bruises or bleeding, or pain or itching in the genital area. We're talking about emotional behavior, talking about touch phobia, discomfort with eye contact, difficulty sleeping or nightmares, loss of affect, depression, suicide, or hurting oneself. Social behavior, increased aggression, increase in being overly willing to appease other people, performance or social skills deterioration, or violating property. And then sexual expression, displaying sophisticated sexual behavior, if that's a change from baseline. Unusual sexual behavior, talking about sexual issues in highly public spaces, or possibly acting out sexually against other people. These are all things that you would consider as compared to baseline, right? As compared to an individual's baseline, and are those changes? So next we're going to talk a little bit about sort of types of disabilities and tips. So I'm going to talk about 4 categories of types of disabilities. These are big categories. And as we talked about before, every individual is different. Every individual has, different needs, different abilities, different ways of talking about their disability or engaging with their disability, or if they view it as a disability at all. But these are just some sort of ideas about things to think about when talking with folks with these disabilities. So the 4 sort of broad areas we're going to talk about are intellectual and developmental, physical and mobility, mental illness, and sensory. So with regard to accessibility, I'm talking about, of course, tips. So there are tips, and then there are accommodations and accessibility. So many of the tips I'm going to talk about might also be required by law. If the person you're working with has a need, it might be something you can ask for as an accommodation, or help them to ask for as an accommodation under the law. So with regard to accessibility, people with disabilities can't be legally excluded from services on the basis of having a disability. Under the ADA, the Americans with Disabilities Act, social service organizations are also required to implement non-discriminatory policies and procedures, provide auxiliary aids and services as necessary for effective communication, and provide physical access to and within buildings. Individuals with disabilities have additional protections under the Fair Housing Act and also Section 504 of the Rehab Act. So when we're talking about accessibility, these laws protect individuals with disabilities from discrimination. They ensure equal opportunities to benefit from programs, services, and activities. The ADA and the FHA, so the Fair Housing Act, require reasonable accommodations to be provided as necessary. Those can look like all kinds of things, right? But some examples here, just to help you think about sort of what an accommodation might be, would be allowing service animals into a facility, providing an ASL interpreter, providing extra assistance with completing paperwork, providing transportation or accompaniment to appointments, extending the length of stay in shelter, being flexible with rules or making like an accommodation to a specific rule or policy, and accommodating requests for room changes. So first we're going to talk about intellectual and developmental disabilities. This is sort of what the category we were talking about when we were talking about mandatory reporting. So two sort of distinct parts of this one, but also potentially related parts. So first, an intellectual disability. This is a disability characterized by significant limitations in both intellectual functioning, so reasoning, problem solving, learning, and in adaptive behavior, so social and practical skills. Individuals with intellectual disabilities may have issues with like learning, paying attention, problem solving, memory, using language to express thoughts. Then the other part of this is developmental. So developmental disabilities are a super diverse group of chronic conditions due to mental or physical impairments. When we talk about disability or developmental, we're talking about onset of disability. So when the disability onset. So developmental usually onsets in utero or in childhood. And so that's why it's called a developmental disability, because it's related to development. Developmental disabilities can cause individuals living with them difficulties in certain areas of life, in language, mobility, learning, self-help, and independent living. Some development, and we'll get to this a little bit later, but some developmental disabilities have an intellectual or cognitive component, and some don't. Some are primarily physical. So some examples, and this is not an exhaustive list, this is just to sort of help you conceptualize when we're talking about different things. Some examples of intellectual or developmental disabilities are cerebral palsy, autism, Down syndrome, spinal injury, brain injury, attention deficit hyperactivity disorder, dyslexia, aphasia, language delay, and fetal alcohol spectrum disorders. You will see some of these reoccur in the other areas that we're talking about as well. So some advocacy tips for working with folks who might have a disability that falls into this category. Remember that the person is an adult. They're capable of making their own decisions unless you were informed otherwise. Don't use baby talk or talk down. Present information in a clear, concise, concrete, and simple manner. Repeat information using different words or communication approach. Allow time for information to be understood. Also allow time for responses. That's often really important. That time for processing, and then time for the person to then ask questions back. Offer to write down instructions if that's helpful. Avoid cliches, slang, and jargon. A couple examples there. So some people take things very, very literally. So idioms can be very confusing. So for example, I wish I were a fly on the wall in that meeting. Sort of that idea might be really hard for someone to sort of parse and understand what that means, right? Fly, well, how would I be a fly, and why would I be on the wall, and what does that mean, what am I doing? Similarly, keep your eyes peeled, like stay on the lookout, or like keep your head up, that kind of thing. Keep your eyes peeled, that idea, like peel my eyes, like what are you talking about, how does that work, what does that mean? So that's just thinking about literal phrasing and how you're using those kinds of things. Analyze activities in small steps and present tasks sequentially. Allow the individual to perform each step after the explanation. That can often be really helpful. So I'm giving you these as tips, but as I mentioned before, the ADA says you need to do many of these things as a matter of law if someone needs them as an accommodation. So go into conversations at a standard level and then adjust as needed. That's usually kind of the best way to handle things. Some additional tips. You can use pictures or simple photographs to identify people, rooms, tasks, or directions. For example, think about the pain chart at the doctor's office, right? Like, where's your pain on a scale of 1 to 10 with sort of the happy, sad, mad faces. Similar. Read information aloud and offer to rephrase if individuals have a hard time understanding the content. Demonstrate rules or guidelines instead of just dictating information. Perform an interview in place of filling out a form. This is a really good tool. Walk the client through questions and help them to answer them. When necessary, you could, act as a scribe and write their answers for them. It might be easier for the individual to communicate with you in a quiet environment. So keep in mind where you might be having interactions. So next we're going to talk about physical and mobility disabilities. So physical impairment is defined by the Americans with Disabilities Act to include any physiological disorder or condition, cosmetic disfigurement, or anatomical loss affecting one or more of the following body systems: neurological, musculoskeletal, special sense organs, respiratory, including speech organs, cardiovascular, reproductive, digestive, genitourinary, hemic, and lymphatic, skin, and endocrine. Ultimately, what this means is that something could be going on with any of these systems in our bodies, right? And if there is something going on with one of these systems in our bodies, and it affects, as we talked about earlier, like our major life activities, that's sort of when we're talking about that being a physical and mobility disability, because we're talking about the physical nature of our body. Some examples here: partial or total paralysis, amputation, a spinal injury, arthritis, muscular dystrophy, multiple sclerosis, head injury, and cerebral palsy. So here you see spinal injury and cerebral palsy again. You saw them in the earlier category. So those things could be either both of those things or just one of them, right? Again, this is not an exhaustive list. But I think it's also important to sort of realize that some disabilities might have different symptoms or manifestations, or every individual is unique and their experience is unique. And so just because someone has a disability that you understand might mean some things in certain contexts, that might not be true for that individual, right? And so really understanding what that individual needs and wants, and how they go about their life and how they talk about their disability is really important. Advocacy tips for people with physical disabilities. It's really important to treat any medical assistance device as an extension of the person. Here we're talking about a cane, a wheelchair, those kinds of things, right? Don't lean on any part of an assistive device. Ask if the person wants to be touched before touching them. Ask if they require assistance. Don't assume they require assistance, right? When possible, place yourself at the same eye level as the person to allow comfortable eye contact. So a couple of reasons for this. One, being at a different eye level than the person you're working with can create a power differential for sure, but it can also be physically uncomfortable for the person. And so if they're sort of looking up or over or down or whatever that looks like, it might be physically uncomfortable. So just really thinking about allowing comfortable eye contact. Don't patronize, don't show pity for the person's disability. And remember that a physical disability does not necessarily impair cognitive abilities. As we were talking about earlier, someone might have a condition that could have cognitive components in some situations, but doesn't in their situation. Or you might look at an individual and sort of make some assumptions, again, based on that implicit bias, that they might have some cognitive impairments as well. That might not necessarily be true. Stephen Hawking is a really good example of this last one. If we think about sort of Stephen Hawking and the physical nature of his disability, but the ways in which he continued to communicate, to write, to be a scholar, those kinds of things. So next we're going to talk about mental illness. So this refers to a wide variety of mental health conditions that affect mood, thinking, and behavior. Individuals with mental illness may have trouble coping with daily tasks and interactions, and the disability may interfere with their ability to think and relate to others. I'm just going to talk about a few examples here. Again, non-exhaustive list. Obsessive compulsive disorder, post-traumatic stress disorder, major depression, bipolar disorder. Oftentimes, bipolar disorder is also referred to as manic depressive illness. Schizophrenia, panic disorder, phobias, dysthymia, seasonal affective disorder, addiction. Of course, there are more. Some advocacy tips here. Always ask before touching, directing, anything like that. Be calm and reassuring. Be patient. Provide more one-on-one guidance to manage panic conditions if that seems like an appropriate way to handle those situations. Allow extra time to understand materials. For example, if someone's becoming agitated in a busy location, maybe you need to go to a different location to manage panic when we're sort of talking about managing panic conditions. Some additional tips here: redirect attention when needed. Entrances and exits should be within the eyesight of the client if that's important to them. Announcing and explaining your actions and movements beforehand can be really important. It can be helpful for some people to know that they can leave or exit if they want to, if they don't feel safe. And then also announcing when you're going to do something. So that's sort of what this announcing and explaining when is about. Like, I'm going to get up, I'm going to go over there, I'm going to grab something, and then I'll be back. So that you're not making movements or sort of doing unexplained things that might make someone uncomfortable. A non-distracting quiet setting can help reduce interference from anxiety. Other symptoms are medication side effects. So thinking about non-distracting settings, and then also thinking about, that someone can feel physically comfortable in that space. So next we're going to talk about sensory disabilities. These are disabilities where one or more of the senses are affected. Usually here we're talking about blindness or visual impairment, and deafness or being hard of hearing. So some advocacy tips here. Help individuals be aware of your presence. So we're talking specifically about working with folks who are deaf or hard of hearing here. So help an individual be aware of your presence. Don't do anything from behind without letting them know you're present. Tap on something. You can tap on the wall, you can tap on the floor, right? You can sort of signal your presence. Never walk directly behind a deaf individual. Try to walk around to let them become aware of you. Follow the individual's cues to find out if they prefer sign language, gesturing, writing, or speaking. Remember that ASL and English are two different languages, right? If a person speaks ASL, they may or may not understand English. They may or may not write in English. Always think about getting an interpreter, even if you might be able to communicate with someone who is deaf in writing. It's always really important to determine what it is that they need to fully understand the situation, because English might not be their first language, right? ASL might be their first language, or they might be really adept at understanding English, but it's in written English. It's really important to just get that sense so that you know that you're fully communicating with someone in the way that they prefer. Speak how you typically speak. Try not to exaggerate your mouth movements. You can slow down a bit and separate your words, but don't sort of try to overemphasize, right? Because that's just gonna be distracting and probably not particularly helpful. But do keep obstructions free from your mouth. I sometimes touch my mouth when I'm talking, so it's really important not to do that, not to like put a mug in front of your mouth, those kinds of things. And then respect a survivor's autonomy. The other thing I'll say about folks who are deaf or hard of hearing is that many people who are deaf will respond to that being called a disability negatively. This is earlier what we talked about, sort of about deaf culture and about the social cultural constructions, right? So someone who is deaf will often say, like, of course, we need to call deafness a disability from the perspective of that's how you get sort of certain services or certain obligations under the law, right? But just because sort of that is the definition someone might fall into, that's not necessarily how they identify or how they think of themselves. And that's particularly true for folks in the deaf community. A few more tips here for working with individuals who are deaf or hard of hearing. Always use a qualified interpreter and advocate for medical and law enforcement personnel to do so as well. There's a couple of reasons for this. The first reason is that it's really important to have a qualified interpreter who's properly and fully interpreting everything that is said by the individual and by the service provider. Super, super important. Second, the person who comes in with them to interpret, so if it's like a friend, a family member, a caregiver, that person might actually be their abuser. And if that person is interpreting for them, you're not going to get that information. You're going to get filtered information. You're not going to get information about that specific person. And so it's really important to use a third-party person, right? To use a person who's a qualified interpreter and who isn't a relative or isn't related to the person, isn't a caregiver, anything like that. It's really important to maintain eye contact with your client who is deaf, not the sign language interpreter, right? Ignore the interpreter. They're an extension of the person. Imagine them like an app, right? They're a tool that information is going through. But you're going to talk to the person. You're going to make eye contact with the person and not with the interpreter. People who are deaf often make and receive telephone calls with a relay service that can be TTY or VRS. So it's really important to educate staff and for you to know yourself how to answer or dial a relay service call. So for example, I have a couple of deaf clients that I work with regularly, and sort of what happens when you call a relay service, and that might be video relay or TTY, you're gonna call. So when I call my client who uses video relay, sometimes I get some music at the beginning, and then a person will come on and say, I'm connecting your call. And then it will be sort of quiet. And then that same person will either say, I have your caller, they've answered the callers on the line, or something else. And so what's happening is the relay service has answered, and now they're attempting to connect to the individual through the technology that they have chosen to use in order to engage, right? And so you might get some quiet space, you might get some relay, you might get a random person that you weren't expecting, those kinds of things. So that is just important to kind of know what that sounds like. So next we're going to talk a little bit about people who are blind or visually impaired. So some advocacy tips here. Allow service animals into your office. Full stop. That's what I'll say about that. Identify yourself when you approach a person who is blind. Explain who you are, introduce others, describe the environment if that's appropriate. People who are blind use their arms for balance. If you think the client needs guidance, offer your arm to them, but don't grab their arm because that could really upset their balance. Don't touch a person's cane or pet their guide dog. Like we talked about before, anything that they're using, that's an extension of them. The cane or the guide dog is an extension of the person. And also that dog is working, and so you don't want to distract them. You should never pet a guide dog unless you're expressly given permission and they're on a break. A few more tips here. Offer to read written information. Convey in spoken words. Excuse me. What is distributed in written form. And have large print materials available. This is size 18. I'd probably go so far as to say like size 24. Often folks with a visual impairment can see really larger font. And so certainly reading written information is helpful. Screen readers, providing materials that a screen reader can engage with is really important. But oftentimes large print materials are helpful, or materials with offset shading. So like where every other line is shaded. Those are all specific accommodations that the individual will be able to tell you, of course, that they need, but just to be aware that those are sometimes things that can be really helpful. Some general advocacy tips here. Don't assume caregivers should be called, or that a person even has a caregiver, right? What if someone's being abused by their caregiver, or they don't have a caregiver, they don't need one? Making any assumptions about that suggests some things that the person should be telling you directly, right? Oh yeah, I have a caregiver, I'd really like you to call them. That's when you would call a caregiver, right? Determine if other needs and intersectionalities besides a disability exist. And then educate yourself on the available resources for persons with disabilities. We're also going to hold that intersectionality question and balance here for a minute as we go to the next slide. Don't suggest or imply that an individual story is difficult to believe. What I'll say here is, particularly with folks with disabilities, grooming tactics may seem extreme or unusual, but that's at the heart of how perpetrators groom. And I assume that we all probably understand what I'm talking about when I'm talking about grooming tactics here, but if not, let me know. Don't assume to know all issues and needs associated with disabilities. It's okay to not be the expert. It's important to not sort of make someone else do all of the emotional labor, but it's okay to not know everything. And you're going to serve a person better by deferring to what it is that they need as an individual. Remember that this individual is seeking services for sexual assault or domestic violence and not for their disability. Hold that knowledge in careful balance, right? So this is what I was talking about in the previous slide about intersectionality and sort of thinking about this. Individuals are seeking services for the specific needs that they're coming to you for. This isn't about their disability. Certainly their disability plays into how the things they might need, the accommodations they might need, the way in which the abuse has occurred, some of those kinds of things. But this isn't about sort of providing services or solving problems related specifically to their disability, right? They're an individual with a disability who have experienced sexual assault or domestic violence, and that part about what they've experienced, that's the really important part, right, that you're focusing on. So don't be offering like random services because they're a person with a disability and you know some services that might be helpful if that's not sort of what they're asking for. Okay. So next we're going to talk a little bit about the Fair Housing Act. And I think everyone, I'm guessing folks have been putting questions in the chat if they have them, but does anybody have any questions about sort of all the information I just covered so far? Any comments?
So far, it seems like you've been answering a lot of the questions that they probably have.
Okay, perfect.
Yep. Mm-hmm.
Very good.
You're doing great.
Okay. So next, we're going to talk a little bit about shelter accommodations and modifications in the Fair Housing Act. So these kinds of accommodations and modifications may be necessary to afford a person the equal opportunity to use and enjoy a dwelling or the premises. So we're going to talk about two things. We're going to talk about reasonable modifications and reasonable accommodations. So an accommodation is a change to a rule, a policy, practice, or a service, whereas a modification is a structural change to a dwelling or a common area. Some examples of accommodations might be, as kind of like we talked about earlier, requesting that correspondence be given in large print or electronically, requesting an exception to a no pets policy for an assistance animal. We'll talk a little bit more about assistance animals in a few minutes. There should be no cost to accommodations because those are changes to rules, policies, practices, or services. A modification, on the other hand, because it's a structural change to a dwelling or a common area, those things might look like a ramp to allow wheelchair access, automated controls to open doors, grab bars added to like a bathroom, a lowered peephole viewer if someone is a wheelchair user, doorbells and smoke detectors with lights. That's often a modification that someone who is blind, or let's see, doorbells and smoke detectors, someone who's deaf or hard of hearing. And then sort of who pays for it here. So with a structural change, with a modification, the individual or the tenant who's requesting often has to pay for that. But if the property receives federal funding, then that looks different. When we're talking about accommodations and modifications, the person requesting the accommodation or modification must have a disability, and there must be an identifiable relationship between the requested accommodation or modification and the individual's disability. This is called the nexus. Must remedy, and the accommodation or modification needs to be able to remedy the disabled individual's inability to use or enjoy the dwelling. right? So say the person needs grab bars in the bathroom in order to be able to use the shower or the toilet, right? That would remedy their inability to use or enjoy the dwelling because the bathroom is an important part of the dwelling, right? Same with accessible amenities in a common area, for example. Okay. And then, so next I'm going to talk a little bit about what is reasonable. So reasonable means it doesn't impose an undue financial or administrative burden on the housing provider, and it doesn't fundamentally alter the nature of the housing provider's operation. This is a super case-specific analysis, so the determination is made on a case-by-case basis. So in order to make a request for an accommodation or modification, a resident needs to ask, right? That request can be oral. Written is always preferable because then there's a record, but a request doesn't have to be in writing. It can be made in any manner or at any time. It can be made by a family member or someone acting on the individual's behalf. So it doesn't have to be made by the family member. It could be made by a service provider, for example, on the person's behalf. And housing providers should place requests in writing, document the outcome, and maintain good records. So if housing provider receives a request for accommodation, either or modification, either in writing or verbally, sorry, they should place that request in writing, document it. I'll also say that requests for accommodation or modification don't need to include magic words like accommodation or modification, but they do just need to identify the things we talked about before. If I have a disability, I need to be able to do X, or I need to have X changed so that I can live in my place, use and enjoy my dwelling. That's enough for a request. And then if a housing provider has questions, they can ask them. They can request documentation, they can verify things. So this next slide is about verifying a request. So if a housing provider, or if an individual requesting an accommodation or modification has an obvious disability and the request is readily apparent, then the landlord can't request additional information about the disability or the disability related needs. So for example, this might look like a person who's a wheelchair user requesting a ramp, right? They have an obvious disability and the request is readily apparent. So the landlord wouldn't really be able to ask any additional questions under the law. But if the person has a disability that is not obvious or the request is not apparent, then the landlord may ask for disability related information. For example, a person with a mental impairment requests an emotional support animal. The landlord might request information that the person has a disability that substantially limits one or more major life activities, information that describes the needed accommodation, and information to show the relationship between the disability and the need for the requested accommodation. Those are the three things, sort of the three areas that the landlord can ask for information in. That doesn't mean that the landlord needs to know everything about the disability or your history or anything else, right? They just need to know enough to be able to consider the request. Housing provider may not acquire confidential medical records or inquire into the nature or severity of a person's disability. Verification of a disability and the need for accommodation, like we talked about on the previous slide, can come from a medical provider, a healthcare provider, a professional representing a social service agency, a disability agency or clinic, or another provider that can verify the disability and the need. Oftentimes, when we're talking about this, like other providers, that can look like sometimes, depending on sort of what the need is and what the disability is, the fact that you receive like SSDI or SSI can also be evidence of a disability. Next, we're going to talk a little bit about animals. So a service animal is what the Americans with Disabilities Act calls the kinds of animals we're going to be talking about. An assistance animal is what the Fair Housing Act calls that same category. A service animal is a narrower category than an assistance animal. And we'll talk about that a little bit more in the next slides. So some people with disabilities may use an animal specific to their disability. Certain laws come into play, so that's kind of what we're going to discuss. So here we're going to talk about the ADA. So for use, this service animals specifically under the ADA, for use in public places. So when we're talking about public places, we're talking about grocery stores, restaurants, leasing offices, social service organizations, public transportation, right? The type of animal has specific care. It's usually a dog. The animal must be trained to perform a specific task directly related to the person's disability. To be clear, trained can be trained by the individual, can be trained by a professional trainer, can be, right? It doesn't have to be like certified or anything like that. It just has to be trained to do a specific thing related to the disability. This could look like a guide dog, a dog that retrieves dropped items, a dog that finds help when the person is incapacitated, a dog that reminds the person to take medication, a dog that detects onset of seizures. Those are all specific tasks, right, related to the person's disability. There are certain situations where animals might not be allowed. That might be like a sterile environment, something like that. But these are also very fact-specific questions. So with regard to a service animal, what can someone ask, right? So in one of those public places, someone can ask, is the dog a service animal required because of a disability? And what work or task has the dog been trained to perform? The dog doesn't have to be wearing a vest. The dog doesn't have to have certification paperwork. The dog just has to be trained to do specific tasks. So next,
Can I
yeah.
ask? Oh, you might actually talk to it, but someone just asked, what about support animals?
Yes, and that's what we're getting to right now.
Perfect.
Great question, Jamie. Yes. So, so next we're going to talk about assistance animals. So under the Fair Housing Act, the term they use is assistance animals. Assistance animals is an umbrella. And so sort of this umbrella in which all of these other things live, right? Assistance animals, therapy animals, comfort animals, service animals, emotional support animals. There we go. Okay. So here we're talking about the Fair Housing Act. This is for use in a housing situation, right? So apartments, shelters, in a person's dwelling. That's what we're talking about. Here, the type of animal is not specified. Be a dog, a cat, a snake, a goat, a ferret, right? Could be anything. As long as the animal provides something like is doing something, right? So the animal does not require specialized training here. They may only provide emotional support or comfort, and that's enough. The animal doesn't necessarily have to be trained to do that, right? As long as the animal provides emotional support related to a disability, that can be enough. So here, what a landlord can ask for is information that the person has a disability that substantially limits one or more major life activities, information that describes the needed accommodation, and information to show the relationship between the disability and the need for the requested accommodation. So like we talked about before with an accommodation, right? Because an assistance animal is ultimately an accommodation. It's usually an accommodation to a policy or a rule. Not policy or rule might be no pets, or something similar. And then I'll go back just a little bit. Jamie, I don't know if that answered your question or not. There are also areas under the ADA where, well, it did good. Okay. Where support animals come into play when we're talking about like employment settings, those kind of things. I'm not really focusing on this area here, but there are other times when, so when we're talking about the ADA and accessing like public accommodations, I think that's the time when you all are most going to encounter a service animal under the ADA. We do, look at potentially service animals or emotional support animals or other assistance animals in the context of other titles of the ADA, in like an employment setting, something like that. And that would also be considered an accommodation, but you'd be looking at that a little bit differently because oftentimes that's like a private employer, right? And so, but yeah, with regard to housing, there is sort of that umbrella. And I think that sometimes that language can be confusing, right? Saying like service animal versus something else. And so that's why the ADA specifically talks about service animals because the law talks specifically about public accommodations and service animals, whereas under the Fair Housing Act, assistance animals is the discussion, because it really is that umbrella, because there's all kinds of things that could fall under an assistance animal category. And when we're talking about a person's dwelling and where they live, their needs oftentimes look different, right, than what they might need in a public place. So yes. And that, let me see, we're here. I think we're here. Close. So I've just got a list of resources here. So DSPD, and then Sago Lilly Center for the Abused Deaf is a really good and important resource. Disability Law Center, that's me, that's us here. And then I have some citations from the slides. So that's all I have. I'm happy to answer additional questions. I'm happy to talk more about anything that anyone has questions about. But I've really enjoyed our time together, and I hope that, I know it's a lot of information, but I hope that it's been helpful.
Yeah, thank you so much. That was awesome. Type your questions into chat. Do you want anything explained a little more in depth? Do you have any specific questions? Now is definitely the time when we have this awesome person here to help us navigate through this topic. Definitely get those questions asked.
Yes, I think that Andy has a copy of my PowerPoint. Jamie, I'm pretty sure. Andy, are you sharing how are you doing that with the PowerPoint?
I sure can. Yeah, if you've given Jorge a copy of it, then I should have a copy of it.
Yeah,
I'll definitely let you know if I don't.
Okay, yeah, let me know if you need it. And anytime any of you, if you have questions, you're always welcome. There's lots of resources you can contact, but I'm always happy to answer additional questions. You can reach me at the information on the last slides of the presentation. Also, if you ever have either yourself or an individual you're working with that's experiencing potentially like discrimination based on disability, you can always send them our way as well. Or if you just sort of have questions, like technical assistance questions about those kinds of things, those are things that we're always happy to answer. We have a really fantastic intake team, and they know all the resources, and then can also figure out if that's something that we can help with. Okay, Anna, what is the process or requirements of applying for disability income like? Okay, so you're thinking like through Social Security, Anna, is that kind of what you're talking about? Okay, so that can sort of, the first thing I'll say is it's sort of complicated in that, so there's two different kinds, right? So there's Social Security, so there's SSI and there's SSDI, and there are different requirements for each, as far as disability onset and some other things. SSDI is ultimately sort of I'll say subset isn't quite right, but ultimately related to sort of Social Security retirement, right? So the idea is, in order to qualify for SSDI, usually you'll have needed to have worked for a certain number of quarters in order to qualify for support through SSDI, or that could be like a family member, a parent, if you had a parent that qualified in that way. But ultimately you fill out some paperwork, you submit it, you answer some questions, those kinds of things. The timeline can be, it depends, but I'd say like at least like 6 months on the short end. But what I would suggest, if you have someone, if you or someone is interested in applying for Social Security based on disability, a really great resource for that, particularly if the person doesn't have, depending on what their income is, Utah Legal Services assists with those kinds of applications. They do have eligibility requirements for as far as who they can serve, right? Because they serve folks that don't have access to other, can't afford other kinds of legal resources. But I would say start with Utah Legal Services if you're looking for help in that regard. We've got a couple of fact sheets on our website, and Utah Legal Services also has some on there. So I would say start there because it's a big question. And I know I haven't narrowly answered it for you, but hopefully that gives you some direction.
Any other questions that anyone has?
Thanks, Anna.
All right. Awesome. Thank you everyone for attending. And again, thank you for Kitty for presenting. That was awesome.